Why US healthcare is so expensive. Any health problem is a serious issue, and when your personal medical experts surrender, you are most likely to visit the US. But do you know why the healthcare services of the US are so expensive? Well, it's not just because the United States has the most advanced medical experts and the advanced types of equipment. The reason is something more than you think. And in this video, you are going to know why US healthcare is so expensive. But before we jump in, make sure you've pressed the subscribe button along with that tiny bell icon. 1. Administrative costs. A report published in the New York Times stated that US citizens are usually paying more for services, but they also pay more for administrative costs related to the country's healthcare system. The US doctors keep using more and more technology in their practice, including PET, CT, and MRI exams. One of the reports says that the US has 35 MRI machines for every million people, while France only has 8. Harvard economist David Cutler says the administrative costs of running our healthcare system are astronomical. About 1/4 of healthcare cost is associated with administration, which is far higher than in any other country. 2. Drug costs. When we talk about living a healthy lifestyle, most of us are used to thinking about spending lots of money on medicines. We can exclude minor flu and diseases here, but a number of believing in consuming medicines rather than doing exercise, yoga, and meditation. But it's a fact that many drugs are more expensive than any other country. A 2018 Vox report showed that Humira, an injectable drug, costs 3 times as much in the US than in Switzerland. Harvoni, a medication to treat hepatitis C, costs $10,000 more in the US than in Europe. Insulin, the life-saving medication for diabetics, costs $350 in the US, but only $50 in Canada. 3. Unnecessary checkups. If you consult a doctor, he/she might have asked you to go over some medical tests. Of course, it's the most common story for anyone. The white coat guy having the stethoscope around neck compels you to make some tests which are definitely a bit expensive. And at the end of the day, when you hand over the bill, it shows a 4-figure digit maybe. A Vox report says that in the US, a routine MRI costs twice as much as it does in Switzerland, and an appendix removal in the US costs $12,000 more than it does in Australia. 4. Higher wages for doctors and nurses. If you're a healthcare professional in a country like the US, I am sure your annual income is higher than your friends around the world. According to the 2014 New York Times story, US doctors are the best paid in the world, but the earning doesn't come through the delivery of care, but from overseeing the business of medicine. Doctors' salaries are higher than the base pay of insurance executives, hospital executives, and even hospital administrators. 5. Fewer regulations to control costs. In most countries, healthcare costs are either controlled or costing is negotiated by the government, whilst in America it is absolutely different. Many experts have an opinion that America's free market approach is one of the major reasons behind the price hiking. Providers largely charge what they can get away with, often offering different prices to different insurers and an even higher price to the uninsured. Healthcare products are unavoidable. It is something you can never say no. It's not like making a comparison before you make the final decision. 6. Insurance premium. According to a report published on Bloomberg News, the monthly cost paid to an insurance company or health plan continue to rise at a faster rate than wages and inflation. The report says that from the past decade, average family premiums have increased by 55%. Moreover, Bloomberg reports that in 2018, annual family premiums for employee-sponsored health insurance rose to an average of $19,616. This marked the 7th year in a row that the cost of family premiums has increased. Because the premiums and deductibles have gone up in the last 2 decades, the percentage of workers covered has slipped as employers dropped coverage and some workers chose not to enroll. According to a separate Kaiser Family Foundation analysis of federal data, fewer Americans under 65 had employer coverage in 2017 than in 1999. 7. Defensive medicine. The term defensive medicine is also known as defensive medical decision-making. The term refers to the practice of recommending a diagnostic test or medical treatment that is not necessarily the best option for the patient, but an option that mainly serves the function to protect the physician against the patient as a potential plaintiff. US physicians are at the highest risk of being sued. and that's the chief reason they order multiple tests even when they certainly know what the diagnosis is. The number of lawsuits against physicians in the USA has increased within the last decades. To deal with the situation, the doctor has to recommend an unnecessary diagnostic test or medical treatment. A 2010 Gallup survey estimated that $650 billion annually could be attributed to defensive medicine. Everyone pays the bill on this with higher insurance premiums, co-pays, and out-of-pocket costs, as well as taxes that go toward paying for governmental healthcare programs. 8. Branding. This is the worst term in the field of medical treatment. Being a consumer, you pay according to the preset price, or we can say according to the MRP. MRP is a standard which decided and set for anyone. However, US healthcare institutions are an exception here. According to George Halverson, the former chairman of health maintenance organization Kaiser Permanente, prices are made up depending on who the payer is. There is no such thing as a legitimate price for anything in healthcare. Andrea Caballero, the program director of a non-profit organization, is trying to get some control over health costs by pushing the ACA, Affordable Care Act, policy. 9. Outpatient treatment. Spending on ambulatory care, which includes ER and outpatient hospital services, are also considerable reasons to increase overall costs. From 1996 to 2013, the annual spending on ambulatory care was from $381.5 billion to $706.4 billion, and there is a rise of about $324 billion that was higher than any of the other 5 types of care analyzed. There is also a significant difference between a procedure is performed at an outpatient hospital center and performed at a physician's office. 10. Greater use of medical technology. Americans are used to spending excessive money over healthcare, and the reason is the technology they use at home. Americans don't like to see a doctor or go to the hospital. In fact, an average American citizen sees a doctor 4 times per year. According to the Commonwealth Report, Americans go to the hospital infrequently. The rate of seeing a doctor is 126 visits per every 1,000 people, compared to 252 visits in Germany, where the rate is highest. US healthcare is more expensive than any other country, but they also provide the best medical treatment. Does that mean they are on the right track? Drop your comment below and share your opinion on this. Please tap the like button and subscribe to this channel for regular updates.